Hello, today we will be discussing our patient for an AP supine abdomen. First, we will need to do our patient preparation, which includes introducing ourselves, stating that we are going to take their images, and ask our patient for their full name, date of birth, and last menstrual period if needed. Our image receptor for this image should be 14 by 17 cassette. Our image receptor orientation should be portrait or landscape, depending on the patient itself and their habitus. Some may require portrait, which is more commonly used, but some may need landscape depending on their habitus size. Image receptor location should be at the table bucky. Our SID should be approximately 40 inches or 100 centimeters. Our patient position for this image should be that our patient should be supine on top of the table bucky and be sure that they are mid-sagittal plane, which is to be censored to the midline of the image receptor. Patients will need to have their arms on their side or on their chest so long as it is away from their body. The part position for this image should be that we need to center our central ray to the center of the image receptor, which should be at the level of the iliac crest, with the bottom of the image receptor at the bottom of the symphysis pubis. No rotation of the pelvis or shoulders is needed for this image. Our central ray location should be at the level of the iliac crest. Our central angulation for this should be perpendicular to the center of the image receptor. Our collimated field size for this image should be the full collimation of the cassette, which is about 14 by 17. Visual of appropriate marker location should be that the marker should be placed on the correct side of the patient around the hip area, away from the anatomy of interest. Instructions to the patient should be that we need to tell our patient to hold still and not move. Tell them that we are going to need to take a big deep breath in and let it all the way out and stop breathing. The anatomy demonstrated in this image should be the outline of the liver, spleen, the kidneys, the psoas muscles, an air-filled stomach and bowel segments, and the arc of the symphysis pubis for the urinary bladder region should all be demonstrated. The items of profile should include the symphysis pubis, the liver, and lower margins included as well in the image. Pathology best demonstrated for this image should be that pathology in the abdomen would also include the bowel obstruction, neoplasm classification, ascites, scalp image for the contrast media studies of the abdomen should all be included. This demonstrates how we should position our patient for an AP supine abdomen and what is needed to successfully get this image. Thank you.